Hi everybody, it is our Q&A daily time today during the International Thyroid Awareness Week. And today's question is coming from Susan, and she asks, any recommendations to deal with cold sensitivity, also environmental sensitivity? Those are the two things that I still seem to have. Thank you for your question, Susan. In humans, the body temperature is controlled by thermoregulatory center in the hypothalamus. And the thyroid is a controlling center of metabolic heat production. And this process is called thermogenesis. Thyroid is playing a role of thermostat, actually doing its best to control that the temperature is constant around 37 degrees Celsius, which is essential to the processes in the body. And when thyroid is healthy, the thyroid is dynamically reacting to the changes in the environment, in the temperature. But when unable to maintain proper body heat, this can lead to cold sensitivity. When the thyroid hormones are too high, the person can experience heat sensitivity. And when the thyroid hormones are too low, the person gets cold sensitivity. By Hashimoto's, both can be observed, cold and heat sensitivities, which is basically can be explained by the fact that there is alternation between hypothyroidism and hyperthyroidism. So Susan, my first advice to you is check if your thyroid hormones are balanced, and keep in mind that there is a difference between standard reference ranges and optimal reference range. And as well as ask your physician to perform a complete thyroid panel blood test. And then have a close look with your physician in your results if there is enough active thyroid hormone or TS3 in your bloodstream. Additionally, I know that many physicians are prescribing a little bit higher dosage of the thyroid hormone during colder months. So this might be also an option to discuss. But besides the thyroid hormones, the recent studies are showing that the immune system is sensitive to temperature and vice versa. So it is important to balance your immune system. Here are some tips. First, I would say remove the autoimmune triggers. And we already talked about the role of sugar, gluten, dairy, iodine, the mineral deficiency that can manifest in leaky gut, and last but not least, unresolved traumas and distress in triggering an autoimmune response. Second, reduce inflammation in your body. Make use of inflammation-reducing foods, supplement with selenium, vitamin D3, adaptogenic herbs, and improve your body ability to detox by weekly taking sauna, and at least twice per year take the Sacred Time program. This is our program that will help you to detox your body. You can use it in its updated form every time by paying just once, and you'll be supported and reminded to do your detox at least twice per year. It's a great way to do so. And work on your boundaries, on your physical, emotional, mental, and material boundaries. Important. And third, enhance the regulatory T cell function by making use of vitamin D3, green tea, and making use of some probiotics. When talking about probiotics, I want to mention that many Hashimoto's are reporting problems when starting taking probiotics. And this can be a result of that Hashimoto's and small intestine bacterial overgrowth are going hand in hand very often. So when the regular probiotics are containing lactobacillus and bifidobacterium, when taking a regular probiotic, it's like you are adding to the bacteria in your small intestine. That's why I suggest that the persons with Hashimoto thyroiditis make use of soy-based probiotics. And my last advice, how to help your immune system, Susan, is I have observed in my practice that many Hashimoto patients have or are highly sensitive persons. And this means that besides all the beautiful sides of being a highly sensitive person, that those people would experience an acute physical, mental, and emotional responses to external and to internal stimuli. So if you are a highly sensitive person, learn to cherish yourself as you are. For example, accept the fact that you are putting the needs of others before yours, and that this brings you joy. While having joy in pleasing others, practice putting yourself first by knowing your boundaries, communicating them clearly, and most importantly, standing behind your boundaries when they are violated. So, Susan, I really do hope that this helps you, and let me know how the things are going. Talk to you soon. Wish you well.